Welcome to this brief introduction to egg freezing. My name is Dr. Rodi, and I'm a reproductive endocrinologist and infertility specialist. If you're watching this video, I'm sure you're wondering, why do people decide to freeze their eggs? And if you're wondering, should I freeze my eggs because I'm going to go have cancer treatment that's going to reduce my chances later on? Or do I want to wait until my mid to late 30s to start a family? Or do I not know whether I want to have a family at all? The answer to all those questions is yes, in terms of thinking about egg freezing. Then the other question is, when do I do egg freezing? Well, of course, for the cancer patient, it's immediately before the cancer treatment. But for everybody else, there's some flexibility. But basically, the sooner the better, because the better yield is from eggs from younger women. So how do you go about exploring this possibility? The first is to make an appointment to see a reproductive and fertility specialist to go over your history, do a physical exam and an ultrasound, as well as laboratory tests that will tell us something about what we call ovarian reserve. And the ovarian reserve tells us really what medications to use and how much. So once we've done all the tests, we go over the test results, and then we explain to you, if we think you're a good candidate and what your expectations should be from the process. The whole process involves starting with medications that are given by injection for about 9 to 12 days. These injections are not perfect, but they're small needles, sort of like a diabetic uses many times a day. You can learn to administer them yourself. You can get a family member or a friend to give them to you. Or if you really would like, you can come into the clinic and we can administer it for you. Most of the patients either give the shots to themselves or have somebody administer it. During the time while you're doing the injections, we do ultrasound exams. And what we're looking for is how many follicles do you have and how big they are. And we document the progression until the follicles, which is where the eggs are, get to what we call a mature size. At that point, we decide on a time for what we call the trigger shot. The trigger shot is another hormone shot which gets the eggs ready to be retrieved. And then we schedule you for the procedure. Now, a lot of patients have anxiety about the procedure because it is a surgical procedure done under anesthesia. The good news is that the anesthesia makes it painless because you're asleep for the process of harvesting the eggs. The actual harvest is done by using the same vaginal ultrasound probe that we used to look at your follicles to visualize your ovaries during the procedure. To that probe, we attach a needle that we put into the ovary under ultrasound guidance. And in a systematic fashion, we go through all the follicles and retrieve as many eggs as possible. Once that procedure is over, you recover in the recovery room. A team of doctors and nurses are with you at all time to take care of you and make sure that everything runs smoothly. Once you recover in the recovery room, you go home with an adult who you trust. You can't drive or work for the rest of the day and night. So somebody needs to be with you, an adult who you trust, for the rest of that day and the night. The next day, you can go back to work and to driving. You will anticipate bloating for another 8 to 10 days. The next day, we will let you know how many of the eggs we retrieved were mature. And those mature eggs are the ones that are frozen. And that completes the journey in terms of getting the eggs and freezing them. you will feel totally recovered in 2 weeks or so when you get your period. That was a brief overview of egg freezing. Let us know if you have any further questions.